A Canadian doctor has become an internet sensation after wading into the thorny debate over Obamacare. The vice president of Women's College Hospital in Toronto set some American senators straight about some of the myths about our healthcare system. As Shirley Engel reports, she's still basking in the glow of her newfound fame.
On average, how many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all.
In her calm, confident tone, Canadian doctor Danielle Martin held her own at this very partisan American Senate subcommittee studying our healthcare system.
I've been joking that I should have applied for Nexus before this because I'm not sure they'll let me back across the border.
Why is that?
In the face of repeated attacks on the merits of Canada's single-payer model, Dr. Martin schooled U.S. senators on the myths of public health care. She shot back when asked about former Newfoundland Premier Danny Williams' controversial trip to Florida for heart surgery.
The people who are the pioneers of that particular surgery, which Premier Williams had, and had the best health outcomes in the world for that surgery, are in Toronto.
Dr. Martin's appearance has created a lot of buzz. Over 350,000 hits on YouTube. She was even trending on social media this week.
I was pleasantly surprised.
Back home, she's made Canada proud.
Finally, some truth is getting out about the Canadian healthcare system in Washington and the United States in general.
With the U.S. in the grips of a fierce debate over Obamacare, the Canadian system has been both bashed and revered.
It's really a fabulous system.
Both sides using it to their own advantage. But while Dr. Martin's Senate smackdown may be making waves here, experts south of the border are skeptical talking points there will change, saying it was more about political theater.
I think Republicans see an opening to really score points against President Obama.
For Dr. Martin, the response back home is what matters, from colleagues, patients, and everyday Canadians.
To some extent, the record had been corrected, and there's some pride in that.
Though she's careful to point out, our system is far from perfect. Shirley Engel, Global News, Ottawa.